Welcome to the Sparked podcast, the show that will get you fired up about standards. On today's show, we have Grahame Grieve, the father of FHIR no less, and HL7 Australia's FHIR Product Director, Peter O'Halloran, Chief Digital Officer of the Australian Digital Health Agency, where he's responsible for stewarding the national digital health ecosystem, products and standards. By the end of this episode, you'll know all about the global standards context and what that means for us locally here in Australia. Let's get into it. Welcome, Grahame and Peter. Grahame Grieve, the father of FHIR, Peter O'Halloran, Chief Digital Officer at the Australian Digital Health Agency. Thanks both for coming along today. We're going to dive in and talk about international digital health standards and what they mean for how we deliver healthcare across Australia and around the world.
I'm Grahame, and it's a real pleasure to be here. I love talking about standards because it's what I do, but they're rather obscure to a lot of people. And I'm really excited that we're talking about the impact of digital health standards on health and Australia.
Brett, lovely to be here with you and Grahame to talk about what sounds like a very boring topic, but is actually essential to all of us in setting those core foundations for what we can expect from healthcare in the future.
Can't be boring, not with names like FHIR and Sparked. Let's dive in. Thanks both. Grahame, first question for you. You're FHIR product lead, although I've heard more references to you being the father of FHIR. So I'd like to ask you to set the scene for us. What is FHIR? What would you define it as?
How I tell my friends when they ask what the hell is it that you actually do is that FHIR is a digital health standard to allow computers to talk to each other about health and patients and coordinate the healthcare system across its many parts.
And so what do we even mean by standard in this context?
So it's a set of rules, very, very detailed rules about what computers can say to each other, what the words they use, how they build sentences to each other, and the coordination of the discussion between them. For instance, when you're admitted to hospital, all the computers that are a part of the hospital system will find out that you've been admitted and know who you are and where you are.
And I'm a public health physician, so I often think about the enabling environment for shifting the dial on health and wellbeing at a population level. Is this akin to an enabling environment? Is it the great foundational piece that allows us to have the digital health innovations and the models of virtual care that we're seeking to create?
I'm wary of saying it's the foundation, but it's certainly a necessary foundation to have the digital health standard that everybody uses that communicates seamlessly across the parts of the healthcare system, from administration and billing through to tertiary care provision, ongoing home monitoring, public health reporting and maintenance. There's a seamless web of what makes up healthcare, and we want to power all of those things so that everybody can have the right information at the right time and perform most effectively. And also a lot of problems in the healthcare system arise in the gaps between the different parts. And so if we can make it seamless, then the gaps become less disruptive.
So that the important clinical and other decision-making can happen eyes wide open with all of the information that should be available.
Yeah, and not only just the information, but a shared vision. One of the things that I see as I go around the world is different parts of the system have different definitions of success for the patient and work against each other for the patient. And that's very difficult for patients to manage.
And what makes FHIR as a standard different to other standards?
It's a standard, and there's a set of ways that we've learned around how to develop standards. And also we've learned how not to develop standards over the decades. And we had the opportunity 15 years ago to reset and start afresh and pick up all the best practices. But most of all, it's the web. So we saw what the web was doing, how it was doing it, what the foundations were to the rest of society, and said, well, let's make that happen for healthcare and see if we can get in front of some of the more damaging aspects as well. But really, scalability, shareability has transformed IT, and we wanted to allow that for health. So we use the web for the way we work. We adopted the way the web developed standards. We adopted web technology, and we built an open community, and that part has worked really, really well.
And it's only one standard amongst a great Farrago panoply of standards.
Yeah, totally.
We talked about the collaboration that you've been engaged in with other standard organisations such as OpenEHR.
So there's hundreds of standards in the picture. It's a dizzying diagram when you draw them all together. And the fact that we're open and we have, an open license has made it really easy to collaborate with lots of standards, whether it's the WHO or the W3C or the UN, which we collaborate with, or national governments or IETF. But within healthcare, there's some particular standards authorities that we collaborate with, SNOMED, LOINC, and then there's also OpenAIR. So technically OpenAIR is not actually a standards organisation. It's an open source community developing a framework for easy exchange of healthcare information. So obviously we're very interested in the overlap between their interests and our interests. It's been a bit difficult for us to collaborate because they're an open source movement and we're actually a standards body bound by standards rules, and our goals and achievements, so strengths and weaknesses, are different. So the last year we've really been picking up and starting to say, how do we work together productively? How do we get our communities to collaborate with different motivations and life cycles? And that's in hand, and I'm really pleased that we have that collaboration going. Hopefully we can leverage their strengths and they can leverage ours, hopefully.
And Peter, as Chief Digital Officer in our Australian Digital Health Agency, or the agency as we love to call it, you've got the national digital health ecosystem in your warm and loving embrace. How's the agency taking a leadership role working with other organisations globally?
Look, I think, Brett, it's all about how do we work with them to ensure that the consumer is always front and centre of mind. And so what we're really doing at the agency is bringing that consumer and clinical lens to all of our engagements with standards organisations, both within Australia, but also internationally. And so internationally, we're active participants in many of the global standards organisations that are relevant to healthcare. We attend conferences, we attend workshops, we're involved in voting, we're involved in a whole of the development of those standards, and we're doing that on an ever-increasing basis. And really for that, what we're trying to do is ensure how do those standards meet the needs of healthcare consumers in Australia and clinicians both now and in the future. And so Grahame mentioned a whole range of those standards organisations, and we sit on those and we're part of those, and I actively lobby some of them and spend far too many nights and early mornings on the phone on international working groups. And really it's all about how can we take those standards and apply them in Australia? How can we make sure that those global standards are fit for purpose in Australia, but also in other care settings that might have radically different settings than what we have here, to ensure that when data is exchanged using those standards, it can flow across the whole healthcare system globally. And that really is the key focus. And I think the other part that we really do that seems to take a fair bit of time is working bilaterally and multilaterally with governments across the globe, and particularly through the Global Digital Health Partnership, to make sure that those standards meet the needs of all of those countries. Because the thing we don't want to see is individual countries going their own way, developing their own standards, which is what's historically happened in the past. And 15, 20 years on, we're also trying to unpick that mess. And that's the core role of what I'm trying to do, is say there are global standards, let's make sure they're fit for purpose for everyone. And each nation then customises them to the absolute minimum amount required, so we can actually share data no matter where a healthcare consumer goes, anywhere on the planet.
Terrific. And coming to Sparked, where does Sparked as an accelerator sit in this context of global standards?
It's really exciting, I think. Sparked is actually how do we go from having a global standard that sits on the shelf, or a set of standards, that actually to how can we implement it in Australia? And so I see Sparked as probably the most exciting FHIR accelerator internationally that's happening at the moment. And it is taking a lot of those global standards. It's sort of picking up some of the core stuff around FHIR and HL7 and SNOMED International and SNOMED CT and all of those things, and actually bring it together in a way that works for clinicians here, that actually brings all that data and those insights together. And if you sit in any of the Sparked events, or you sit in some of the discussions around sort of the clinical working groups or the technical working groups, it's all around how do those global standards get implemented in Australia in a way that actually works for Australians. And that's the exciting part of Sparked.
So if I can comment too, the international standards say what everybody in the world agrees to. And lots of health is the same everywhere you go. But other bits are really, really different because countries make their own laws for their own culture, for their own language. And we can't get everybody to agree to things that are specific to particular countries. So every country needs to have a way to adapt and extend and build on the standard to say, now the things that we do differently here in Australia or France or Germany, wherever, how are they going to work? We need to make our own agreements on top of the standard. And that's what Sparked is doing. It's making our own agreements for what we need here in Australia that's unique to Australia.
And so other international accelerators just have a slightly nuanced and different view according to their own needs compared to Sparked?
Yeah, I mean, Sparked is very much based on a US model. We're a US accelerator that's focused on the big vendors working to make data available to patients. And so it's very similar in that regard. But then there's other accelerators. For instance, the US has a really active accelerator focused on trying to improve the woeful billing system that the US has. Well, we don't care about that. That's their problem. And then there's another accelerator that's usually, it's a bit Europe and America. It's focused on public health data for shared public health concerns frameworks that they have there, which doesn't yet have much Australian focus. It's not specific to a particular country. It's more focused on public health infrastructure reporting. Should we be involved in that? It's sort of over the horizon for us. We haven't really considered how much we should be involved in that yet. Maybe, maybe not.
I know Sparked is being presented at the HIMSS conference next year in Las Vegas, the Health Information Management System Society conference. And so there are eyes on Sparked. Do you think we've got lessons to show the world?
I personally do. And it's one of those things where everybody's playing leapfrog with each other. You know, we figured out a way to do things that worked really well. So other people picked it up and made their own improvements to it. And we look at that and say, well, we better copy them. And so Sparked is, you know, the most recent and the most active of the accelerators. And I think that we're doing a particularly good job of engaging the community and the clinical community. And the other accelerators will be paying attention to the tooling we've done for that and the messaging and the community building and looking, as always, say, how do we do what we're doing better?
And now it's time for a fun fact from Kate.
Do you know we have a LinkedIn page? This is where we share events and happenings in the Sparked community. Why don't you give us a follow? 1,400 other people have so far.
Peter, what does it mean for Australia to be at the leading edge when it comes to standards? What's the benefit to our industry in Australia, leveraging but also collaborating in the development of international standards?
Look, I think the first part is it actually helps our industry and all the expertise we have in Australia actually shape the way those standards will be implemented globally. And that's a really critical thing to ensure that those global standards do actually meet our needs. But for industry also, look, people are in it for a business. They need to generate revenue to actually stay in business and keep providing solutions. And that's, I think, where the global standards push in Australia really is helpful. What we're trying to do is ensure that those Australian businesses have opportunities in new markets overseas for exports. Building and developing software in Australia that actually meets Australian needs, that's compliant to international standards. Then when they're exporting those overseas, there's a whole lot of really amazing examples of Australian companies innovating here and exporting health solutions internationally. It becomes easier for them to enter those new markets and those barriers are reduced. Likewise, there's also, from a consumer and a purchaser perspective, the ability for other products and global innovations to come to Australia more quickly. Historically, if you saw some systems brought to Australia, it would take a number of years for it to be localised to meet our requirements. What we're hoping with the push down the global standards path is it becomes much easier to bring those products in much quicker as well. So that we actually have the best possible IT solutions for clinicians and consumers to actually try and, I suppose, provide enabling services so healthcare really can meet all of our expectations.
I want to agree with what Peter said there and add something of my own to that, which is that in the space of consumer healthcare software, we're really talking international software. We're not talking, oh, there's an Australian version. So it's not an Australian version of iOS on iPhone or Android, for instance. For me, one of the driving purposes of saying that we need international standards, we need Australia to be involved with those, which is why I am, and we need Australia to leverage those because at the consumer level, it's much harder to do Australian-specific work.
And it's also about, I think, Grahame, as Grahame said, it is global, and Australians love to travel. We all know that. We all love to get out and about, and I think it's sort of one of those things we all wish we could do more of. adopting these standards actually lets us help our information flow globally when we're travelling. And so one of the things I'm focusing on at the moment, I know Spark's working on it, is the International Patient Summary. How if I'm travelling overseas to, I don't know, pick 3 or 4 lovely destinations, I have a health issue there, how can they get ready access to my health information in a way that suits and fits their systems and is standardised to the internationally agreed nomenclature and terminology? And likewise, when they provide that care, how can that data flow back to my records in Australia for my GP to see what crazy thing I did and what treatment I got? Being part of that global standards community and having our vendors and our software industry involved in that also will help that information flow, which really I think for all of us just means hopefully better access to the information and access to better care.
And what does it mean if standards aren't aligned? How does this play out in the real world? Any examples that come to mind for you, Grahame?
I run across him a lot, but let's talk about a friend of mine. He's getting on a bit in years and he's got a cancer, and he went to a specialist and the specialist referred him to imaging, and he had some imaging done and he went back to the specialist and his cancer was coming back. That was a real concern. And the specialist was like, but I don't have your imaging back. And he's like, but I did it 3 days ago. And that's because the standards at the technical level weren't talking. So the radiology service that had done the imaging thought they'd send it to the specialist, and the specialist like, but I don't have it, because his system wasn't prepared to pick it up in the same format. And he's like, come back in 3 months. He's like, I don't have 3 months. And every patient has a story like that. And those stories are very often driven by administrative confusion that grows out of incompatible standards. There shouldn't have even been a potential for administrative confusion. And then you can just magnify that. I'm driving around Australia with my wife at the moment. They have the same thing happen between states. States don't share records with each other in Australia. And my wife went to Germany last year and got sick. And we had no way of communicating her detailed records about her various medications to the German clinicians. And that's where the International Patient Summary that Peter mentioned, love it. It's key for travellers, and we have an increasingly mobile world. And the challenges at the technical level usually manifest to patients as the system is confused. And
Peter, any examples from your experience that you want to share?
Look, I mean, I think Graham's right. Every patient has that experience, and I've got friends and family and I've experienced it myself. It's also much more fundamental, even if we think about supply chain issues. Like, I've been involved over my career a couple of times in some of the emerging man-made or natural disasters, where it's even meant simple things like blood couldn't be moved from one country to another, where people needed a blood transfusion urgently because they use different standards and different ways of identifying them. So it comes down to everything from care of ourselves and our family and friends, right through to much more fundamental things of we can't get the critical life-saving supplies that are needed from one part of the world to another when there's a crisis. And that's really the power of standards, to actually let those bits of data or those supplies flow naturally.
What do you think Sparked means for the future?
From my point of view, we had this really weird situation where, obviously I lead the fire community from Australia, but we didn't for a long time have any official Australian community that I could refer to. So people say, well, what does Australia think? And I'm like, I don't really know that I can say, because we don't have a community to answer that question. And now we do. For me, it's an interface. It represents Australia to the rest of the world, and it represents the rest of the world to Australia, and is a bridge whereby the technical aspects of digital health and the policy aspects of digital health can interact with the rest of the world. There's other forums, particularly for policy, but if policy and technical aren't talking to each other, then, well, we know where that ends up. Sparked is a key structural piece in building a digital health ecosystem that everybody can leverage and is open and usable by consumers, clinicians, public health, authorities, so forth.
I think it's an opportunity really for Australia to actually show the world what we can do. Often we have the tall poppy syndrome in Australia, and we don't want to look at some of the great successes we have. And I think in healthcare interoperability, we've got a long way to go, but we've actually done a whole lot already. And I think we forget that sometimes. With Sparked, I think it's one of those core foundations, along with sort of the standards and the terminology and how it's implemented along with some of our national infrastructure and some of those other services, where we can actually set a new benchmark for how health data can just flow and can flow seamlessly. I actually think that's the exciting part internationally, is Spark can show the world how it can be done.
Grahame, Sparked is mobilising the fire community. Tell me a little bit more about the unique elements of that community coming together. What do you love most of all?
It's a wonderful thing for me. I've been doing this a long time now, and I talk to some of my, social peers. One thing that the health community has is an abundance of people who truly believe in the greater good and believe, rightly or wrongly, that they've put aside extra income they could make as a banker or whatever to work in healthcare and to be really focused on health outcomes, common good, healthy and happy people. And I really love being part of a community that can leverage tech into those outcomes. So we've been encouraging community building in an open platform, open way around the world. And we've picked that up and run with it as strength here in Australia. And for me, there's a couple of unique features about the way we're going about it here in Australia. One is the role of the CSIRO, in that the government has asked CSIRO to step forward and play a leadership role as the secretariat and also the coordinator. And CSIRO has been very active in reaching out to companies and state authorities and colleges and institutions and asking them to take part. And that, that role, I think, has worked really well and is something that other countries are looking again at, should they have that role. And also we've had really good messaging support from the Commonwealth authorities, the Department of Health, and also the agency, the Digital Health Agency for Peter's part, and that have encouraged participation in the community. It's a bit hard for governments to encourage an open community to run the standards. It's good on the way, and it shifts the burden over to the open community and particularly the risk associated with it, but it also cedes some control over timelines. It's very challenging. And the Commonwealth is very much in support of Sparked, and I'm really appreciative of that.
And Peter, what are your perspectives on this?
Every time you go along to a Sparked event, there's more and more people coming along from different walks of life, different clinical professions or different software vendors that we haven't seen before. And I think that's the true power of Spark. It's continuing to bring diverse groups together with a common goal. And we're seeing that not only in Australia, but I'm now seeing a number of those organisations, a number of those people acting more internationally. And so certainly, for example, if I look at, say, SNOMED, I'm hearing we've got a lot more Australians actively doing things with SNOMED than ever before. HL7, it's kind of like you go to some of these events now and you walk around everywhere you go and you'll hear an Australian accent here and there and all over the place. And that's the great thing, is that Sparked has generated this excitement, I think, in the community in Australia. It's built a community, it's generated that excitement, and we're now exporting that to the world, which I think is an amazing thing.
Good way to end. Love it. Passion for public good. Thank you both so much. The Sparked podcast is brought to you by the Australian Federal Department of Health and Aged Care, CSIRO's Australian eHealth Research Centre, HL7 Australia, and the Australian Digital Health Agency. You can join the community by heading to sparked.csiro.au. And don't forget to join us on LinkedIn at SparkedAU. This show is hosted by me, Brett Sutton, Director of Health and Biosecurity at CSIRO, and produced by Ed Studios' Janine Hamer and Lucy Ratz, and CSIRO's Dr. Naomi Stecklenburg. Sound by Hayley Dell.